I
Okay.
think.
All right. I don't know what happened. I
I
know all
know.
of a sudden, same thing happened. We were just there, and
It
all of a
was like,
sudden, the screen
I
went
don't
like,
know. I
the
thought, did
live
it
is
just
ended.
time out?
And I'm like, oh, wait, we still have
Yeah.
so many questions to go over here. So, okay. So let's see. When we got off, we were kind of talking about natural things, right?
Yeah.
And that some people think that they would not be a candidate for HRT, but they should always check to see.
Yeah. Yeah.
And I don't know if people realize, but like with Amazing Meds, what I love about them is that you guys do consultations with people. And if you go through the link in my bio, you can actually do a complimentary consultation in there. And I have all the details on that. So, but let's go to the next question. And talking a little bit more about hormone replacement, I think the other thing I get from people all the time, whenever I post a live, people have this thought in their mind because they've heard this before, that taking estrogen causes cancer. And I feel like I want to talk about this
Yeah.
in every live I do because it always comes up. So can we
Yeah.
talk about that?
Of course. I mean, there's a huge misconception. And about maybe 15 years ago, I might be getting maybe 20, a huge study came out saying, estrogen causes breast cancer. And it was like in the media and went everywhere. And I think that's kind of where it all originated. They later like redacted that and said that like that's not entirely true the way that it was published, but it already kind of gotten out there,
Mhm.
which is always was something. You get a thought in your mind
Yeah.
and it's like it's there now.
It's like
And so I get the question.
every doctor read that, and just they've never read anything
They've
new
never.
since then.
Yeah, yeah. And so it's complex in the sense that it's like propaganda, and that there's pieces of truth in this and not pieces of truth,
Mhm.
right? So, like I told you, there's different types of estrogen, so estradiol, estriol, and estrone. And so estrone is definitely linked to breast cancer risk, which ironically, that's the predominant hormone of menopause. And so I always tell people, I feel like you're almost better off doing hormone replacement in a safe way where your levels are being monitored and you're being checked and things like that, but then not doing it, because then essentially you're just in a predominantly estrone state. But then also the routes and the way that you take the medications and the levels are really important. So a big thing is like everything has to be in balance. So you need estrogen and you need progesterone to balance it. And a lot of us, just based on environment, based on stress, based on these chemicals and toxins and things that are in our food, in our water, it's just inevitable. We can't escape those, right? But
Mhm.
so sooner and sooner in life, our progesterone levels are declining. And so we're spending lots of these years in this extremely estrogen dominant state.
Mhm.
It's not just estrogen, you need a balance. And so, and hormone replacement could be negative if done incorrectly, but done correctly, in my opinion, and the research done correctly provides longevity. So if anything, it's protective to you. Progesterone is protective to the breast tissue, and stimulates breast tissue kind of like breakdown, whereas estrogen is stimulatory. So when they're in a perfect harmony, like yin and yang, everything is well. It's only when that imbalance is there.
What are your thoughts on um, supplements, taking supplements like DIM when you're taking estrogen? Do you think there's a benefit to that?
I still do, because none of us are going to live like this perfect, like in a bubble, right? And so we're still
Mhm.
going to be exposed to plastics and, pesticides and all these other things that still are going to do some hormone disruption. So 100%, I love DIM. I think it's amazing. It's one of those like key supplements for sure in hormone
Do
health.
you think, I took DIM for years because before going through menopause, I tended to definitely run more estrogen dominant. I mean, I had endometriosis as a young, I've had several different
Mhm.
things. So I took DIM for a long time, but then I was afraid to continue to take it when I started taking estrogen because my estradiol levels were so low. I was afraid, like, okay, well, if I'm taking that, is it going to lower my estradiol, or is it more just metabolize the bad estrogen out?
Yeah. So it's more so just making a balance. So it's metabolizing out the bad estrogen so that you've got a perfect balance, a ratio essentially of estradiol to
Okay.
estrone.
So it shouldn't really lower your estradiol numbers. Okay. Okay. Okay.
Yeah,
That's good to know.
no. And
I'm gonna
I
start. I'm
mean,
gonna start. taking it again then.
Yeah, no, I think it's great, and protective long term. And then even
Yeah,
for people who are like, I don't know if I want another supplement, like I said, the cruciferous vegetables are amazing, kind of natural source for that too.
yeah, it is. It's just sometimes for some people, like I love cruciferous vegetables, but too much of it, and it's like I feel like
Hard in the gut.
so
Yeah, you feel bloated.
yeah. So that's what I
Yeah.
like about that supplement, because somebody is asking what is DIM. Can you explain that? What
Yeah,
that
so it's a
supplement
natural
is?
substance that's found, like I said, naturally found in like the cruciferous vegetables, so broccoli, cauliflower, bok choy, and it helps through liver metabolism to clear out we would consider it like negative estrogen, so the estrogen form that's not great for the body and can cause negative side effects in long
Yeah.
term.
And you can find things like supplements like DIM Detox or something like that,
Mm-hmm.
is a
Yep.
good one. So,
Yep.
okay, next question. How do hormones, and we kind of touched on this a little bit, but how do hormones impact weight gain during menopause, and why does fat seem to accumulate around this midsection here? That's like that's everybody's biggest complaint, like their weight all shifted like overnight there.
Mm-hmm. Yeah. So, I mean, that's partially, cortisol, as well as during perimenopause, what's happening is you're having a fluctuating. So you're having higher
Mm-hmm.
levels of estrogen at times without enough progesterone, which you can do that. And then you're also having lower levels. So, I always say hormones are like, it's a bell curve. Like too little isn't good and neither is too much. So you
Mm-hmm.
really want to be in this perfect middle space. And so either too much estrogen or not enough estrogen, either of those can actually cause you to have weight gain. So that's largely what's kind of going on, as well as like the adrenals. Like I said, the stress hormone cortisol also plays a big role in fat deposition in the midsection.
Okay. So, I had a question. It came to my mind as you were saying that, and it just went. See,
No worries.
still, I probably need more estrogen, because it just went right from my brain what my question was about the fat storage. All right. Well, hopefully it comes back
Yeah,
to me. But
no worries.
I'll move on. I'll move on to the next question. Let's see. The next question was, can I lose weight during menopause? And are there specific strategies that work better at this stage?
Sure. Yeah, so I mean, I can kind of touch on the hormone stuff, and I'm sure you can probably give like tips on
Mhm.
specific
Yeah. Yeah,
exercises
that'd be
and
great.
stuff.
Mhm.
Yeah, so I mean, a big thing is, you're gonna need your testosterone levels to be optimized. That's gonna be super key to being able to build that lean muscle and maintain that basal metabolic rate. So for that's really important, the biggest piece. But as far as particular types I mentioned, strength training is really important, not just cardio. Like you need to be working the larger muscle
Mhm.
groups, but you're kind of the expert on that. So you definitely could touch in on certain particular types of
Yeah.
exercises. I'm
Yeah.
curious.
I mean, my thoughts with that, and I always tell like my, clients, because I kind of go through steps with them, and we do get to a point where we discuss hormones, and that's when I, refer them over to Amazing Meds, or but I always tell them, like, don't even even think about that until you got to dial down the basics, first, because yes, hormones could help you lose weight, but if you don't have the fundamentals in place, it's kind of like you're slapping a Band-Aid, on it. Like, you have to dial in your nutrition first. You have to dial in your lifestyle habits, like you said, your sleep, your managing stress, those things. And then you have to build muscle, but you also have to eat in accordance to build muscle. So many women are out there and they're lifting, but they're eating like 60 grams of protein a day, so they're not even giving their body what it needs, to build muscle. So I feel like you've got to get the fundamentals down, and then at least, start doing them while you start to incorporate the hormones also, because otherwise I see a lot of women go on hormones and then they're like, I went on hormones and I gained weight.
Mm-hmm.
And it's like, okay, but what else did you do besides, go on the hormones?
Right.
And maybe you can discuss a little bit that topic of the gaining weight
Yeah.
from going on hormones, because that is a big complaint. And I know that I just sent over a very close friend to you guys, because she worked with several practitioners, and every single time she's, I mean, immediately gained like 10 pounds in the first like couple weeks of going on hormones. And
Yeah.
so I'm like,
Yeah.
either you're not getting diagnosed, you know, you're not getting the right dosage, or there's something, you know, going on. So can you explain that a little bit?
Yeah. So a lot of times what I see when I have patients that transfer into me from somewhere else and they're doing hormone replacement, and that's been their primary complaint, is like, as soon as I go on this, I like blow up like a balloon. A few things like quickly kind of light bulbs go off for me would be they're being overdosed on their estrogen. That's one. Remember I said estrogen, you don't want too little, you definitely don't want too much either. So estrogen is going to make you put on weight if it's too high, and it's also going to make you retain fluid. So even my male patients on testosterone, we have to actually block it from converting to estrogen, or they'll start gaining weight and start retaining fluid. So you don't want too much, you want just enough. So either their estrogen is too high, their progesterone is not high enough. That's another big thing. So you have to get this good balance. It's not an automatic. So what I've found is they come from people usually who want to make a cookie cutter approach. They want to create an algorithm for hormone replacement, like conventional medicine does for stuff. You go into the doctor and you're like, my throat hurts. They're like, okay, here are my options to treat you, X, Y, Z. And it's very much cookie cutter. But with good hormone replacement, you can't really do that. You need to customize it to the person. And so I think that's where it goes wrong, when you're at somewhere where it's like, everybody gets this milligram of estrogen and everybody gets this dose of testosterone. And that just doesn't work. So
And I think also a lot of other like practitioners or companies out there, I've even seen this with other like telemed companies, that they prescribe and then they never check the, you know, levels again to see what's going on. So how do you know if you're giving them the right dosage if you're not even checking like 3 months later or whatever to see, you know, if it's working? So
for sure. Follow-up is super important to, you know, not only with labs, but also how you're feeling and making sure so that you can tweak and adjust it accordingly, because it won't be the same for everybody. So.
I really like that, because I feel like, you know, especially when I first started, I feel like now we've got it like everything dialed in, because I've been on, it's been actually like exactly a year since I went on the hormones. But like the first, you know, every 3 months we were checking them. The only thing I find like with myself that I've had like a harder time with my level going up that quickly is my estrogen. So do you think that some people, because I do I'm doing the cream. Do you think for some people they have a harder time absorbing it, or why do you think with some people it doesn't go up as quickly?
Some people don't do well with that. So there's multiple ways. That's why it can't be cookie cutter. Like, you know, I think definitely there's a majority. Most people do okay with the cream and do great with the cream. But there's going to be a percentage that maybe a patch would be better. I personally don't really love doing oral estrogen, just because when you do it orally, it has to go through the liver, and the liver doesn't quite know what to do with that, and it can it can raise clotting factors and all these other things. So that's not my favorite route at all, not usually the route I go, but we can tweak it essentially if it's not working.
And I think last time we did like I think they upped the, like, I didn't need to do as many clicks, but they upped the like, percentage in it. So and I wasn't really having a lot of symptoms anyways. Like I wasn't really having hot flashes. So it wasn't like the fact that it didn't raise that much made a difference to me, because I felt really good. So that wasn't really an issue. But do you think that there's areas that are better for absorption for women?
So usually I recommend like the forearm here, where you're thin, you got thin skin and you can kind of rub it in. Some people do the inner thigh as well. I always caution people with that for their partner, like the timing of day that you do it, so that you don't, you know, do it close to a time where you're going to be nothing.
So your husband doesn't, or your partner doesn't
he may not want
breath.
that. Exactly. Doesn't want any more of that estrogen. So, but yeah, so inner forearm is usually my preferable spot. It's quick, easy, it absorbs really well, and that you're correct in that a higher concentration with a lower clicks is better. I found that the less you have to absorb, the more accurate it is. And
I think that probably made a difference for me. Do you feel like you need to rotate it, or can you do it in that same area all the time?
Most people can do at the same time, but like when I say things, usually most, I'm saying that like I really focus a lot. For me, I listen to my patient. Like they're the ones that know their body the best. So if they say to me, I don't know, it just feels like I'm doing it in this spot, but it doesn't feel like it's working, let's try another one. Maybe for you, it's going to be different. Or, you know, I don't know if this route's working quite well. I give them other options and we'll change it. We'll try something different. So there might be a majority, but there's always that window of people that do well with a different route.
What about would you absorb it if you put it on your neck and your face? Because you know how there's all these things, like there's so many things out there now about using estrogen cream on your face, like for aging,
rejuvenation and stuff. I think it's
but would you absorb it enough that it raised your serum levels?
So
I'm asking this stuff personally for myself.
I mean, I think you can get some. I mean, most of the formularies that unless you're using your actual cream you're getting from us, is that what you're thinking? Or are you thinking of doing
well, you know what I always do is I rub it in, and then you still have like a little excess on your hands, and so I just take the excess and I just go and I put it like on my face and my neck. I figured I don't know if it works, but I might as well. It's better than like wasting it, you know.
So, why not? Like I think it's a great idea. I wouldn't say like if that was your only route of getting the hormones like to your system, I wouldn't use that exclusively. But the way that you're doing it, why not? Estrogen's great for collagen production and elastin, and so do it. You have to keep me posted on how it's going.
Keep doing that. Somebody asked about what about the patch on the lower belly?
So the patch works well for some patients. I do, prefer the cream. And most of the patches, if you're getting it kind of commercially available, the dose is so much lower than the bioidentical creams that we usually prescribe. So it's like, for most patients, it's really good at keeping those hot flashes at bay, but not really giving them the full amount they need for the rest of the vitality benefits. So.
And I think one of the things that a lot of women don't realize, and I mean, for myself, when I decided to go on hormones, I had several different reasons. And it wasn't because I was having a ton of symptoms, because I think when I went into menopause, which I was about like 52, 53, and I'm now 56, almost 57. So when I first went into menopause, I actually felt a lot better, because perimenopause was kind of like all over. So I was kind of like, oh, I feel like
relief,
better, like I'm not having these horrible periods, I'm not having, and so I felt better for a while, and I never really had a lot of like symptoms, because I just feel like I went in really with a good diet. I was already strength training, I was doing all those things. But the more research I did, the more I decided, for several different reasons. Both my parents have now just like since passed, and they both had Alzheimer's. So I was really, really concerned about brain health. That was like a big thing for me. And I knew that estrogen, there's a lot of benefits to, to our brain and our bone health and our heart health. So there was a lot of, like, I think a lot of reasons women don't realize the health benefits of like why we need estrogen, and like yes, could there, I guess, like, to me the benefit outweighs the risk, because I feel like there is a lot of health benefits, to longevity and things like that. And then for the vanity reasons. So I should be honest, like, I mean, one of the other big things I really started noticing, and it was a big reason why I was like, I think I could do something, is that I felt like the first 2 years after menopause, I didn't notice it so much. And then all of a sudden it was like, bam, it's like you aged over, like, overnight, your skin, like, just, it just takes a toll.
Out of nowhere.
Yeah. And I think that if a lot of women, like, if you're experiencing that, where you feel like, oh my gosh, I'm just starting to age, really rapidly. And I've heard things about that it takes about like 2 years after menopause, and then after that, your body starts to like really lose like collagen super quickly.
Really
so so it's just one more reason that I think that for, a lot of us women, if you care about, your skin and things like that, and health, that it has benefits. But okay, well, do you have time for a couple more questions? Let me read this one on here. What testosterone do you usually prescribe? Does it increase risk of blood clots?
No, it doesn't. So we prescribe typically, now that, like I said, this isn't like cookie cutter, so there might be a few exceptions, but the vast majority it's testosterone cypionate. And the best route to do it is actually an injection, subcutaneous. So it means a tiny little needle that you inject into your belly, fat into the fatty area. You just pinch a little bit of fat. It doesn't hurt. So there's just that like learning curve of, I'm poking myself, but it doesn't really
Yeah.
hurt.
Now I'm so used to it because
Used to
I
it?
do that and then I do some
Yeah.
peptides. It's like I feel like every night
Like
I'm just like,
poking up all the time. Yeah, you're like,
yeah.
I'm a pro at this now.
Yeah.
um, so yeah, that's the best way to do it. So the increased clotting factors are associated with oral routes of hormones, and so that's why I said also oral estrogen is not great.
Mhm.
And that, I mean, that goes hand in hand with even birth control, which is kind of funny. Hormone replacement gets kind of like stigmatized, but then like when you go to the OBGYN, usually the solution is always like, here's some birth control pills, right?
I know, and yet in women I have no like qualms about
Not for
taking it.
contraception, just for like, yeah, if you're feeling sad or your periods are heavy, like
Oh yeah, no. For a
here's
lot of, I see it all the time where women, like they're starting to have symptoms and they
and
get,
that's
they don't even need it for
right.
contraceptive anymore.
Right, and they're just wanting it for that. So
Yeah.
yeah, and so the oral route is the one. Your liver will raise clotting factors when you take oral hormones. So that's why that's not the preferable route to go, with the exception of micronized progesterone. So
hmm
which is slightly different than progestin, which is what's in birth
What
control
about
pills.
the,
So.
because I just had a client the other day that just worked with you guys and she did cream testosterone and I wasn't sure if it was like a if maybe she just didn't want like if
Yeah,
there was a reason. I didn't ask her,
sure. Yeah. So you
but
have
I
some
was wondering
patients.
if it
Oh,
was
go ahead. Didn't want to
if
interrupt.
there was a medical reason or if it was just like some people just are like, no, I don't want to inject myself.
Yeah, so sometimes it's just a preference, for the patient. Like I always, like I said, I try to educate the patients on like based on my experience and things like that, what I would advise. But ultimately, I also listen to my patients. So if they're like, I'm not a needle person, I cannot do needles, then we're going to find them another route.
Yeah.
So yeah, that isn't usually the first route that we would go. But if the patient doesn't want injections, then that's an option.
Okay. Let me see what I've got left here for questions that we haven't covered yet. Okay, we kind of talked about this, but maybe we could talk about it just a little bit more. What are hormone disruptors and how do they affect hormonal health? And how do you minimize them? So we kind of
Sure.
touched base on that, but
We did kind of, yeah. So, I mean, plastics are a big one, and obviously, so limiting, you know, packaged foods. Most of our processed foods are going to be in plastic, obviously, but even like water bottles and if you're going to heat something up in the microwave, don't do it in a plastic container,
mhm,
obviously. Those kind of
yeah.
things are ways you can limit that. And then you've got pesticides that are also endocrine disruptors. So that's going to, mess with not only the gonads, so the sex organs, but also with your thyroid, which is another really important endocrine system for
Mhm.
energy and metabolism and things like that. So, eating organic when you can, especially like the Dirty Dozen. If you can't
Right.
do everything organic, just do those. You can Google a list of what's the Dirty Dozen, and then using like a particular method to wash your fruits and veggies. You can do that.
Mhm.
Limiting fragrances.
Yeah,
So a lot of fragrances
I
are
was
big
gonna say it's a big
disruptors.
one. Makeup, fragrances, even like people like
Cosmetics.
who have those like plugins in their house, like
I
all over the
know.
place,
Yes.
like they don't
Totally.
realize, or even most candles or things like that.
Yeah.
Like when I see like people like stocking up like at the holidays at like Bath
At
and
Bath and
Body
Body
Works
Works.
stuff, I'm
You're
just
like,
like,
no, please.
like,
Yeah, please don't.
like how much like that,
Yeah.
has so many hormones, or like you're buying it for your teenagers and things. And I'm
I
guilty of that.
know.
Before
Yeah.
I realized it, I was buying that stuff for my daughter. Then when I switched over and I really got really educated, then I started feeling so, it was
Yeah.
everything was all like natural products.
Natural. Yes.
Yeah.
Yeah.
So anyway, so yeah, I don't think people like realize that, but knowing that coming into the season of buying gifts, like, that's one of the best things you could do for yourself or for your teenage daughters is, I mean, there's a reason why so many young girls, I mean, I have friends whose daughters have gotten their periods at 9 years old. Like
Yeah.
that,
Yeah. It's starting sooner and sooner.
yes. I mean, it's a lot of what's in our
It's very
environment
true.
that is is impacting us. So there's, you know, it's definitely something. It's not just our food, but everything. I mean, we're being bombarded from, you know,
Yeah.
and I know you can't do everything, but every little thing, you know, switching your deodorant over, switching your,
Yes.
you know, what you put on your body, you know, can make, you know, a little bit of a difference for
Yeah.
sure. So, okay. So I think there was a question somebody asked, and I think Carla probably answered it about about insurance. I don't know if
Okay.
you know that much about what
No,
the insurance part of it,
I
but
don't have the
I
answer
hope
on
Carla,
that
somebody
one.
asked about
Sorry.
that. And
Yeah.
somebody also asked, is the testosterone cream as effective as the injectable?
So, in my opinion, and based on years I've been doing this, the injection is the preferable route. Essentially, when you put cream testosterone on the skin, your epithelial cells will aromatize it. They're more likely to, which means they can convert it into dihydrotestosterone. And it's a different hormone. There's a lot of this converting you'd hear me talk about, but
Yeah,
dihydrotestosterone is what actually causes male pattern baldness. So,
that's what I was going to say. That's DHT, right?
yes.
Is that what
And
the
so
part?
it can
Yeah.
make your hair thin, it can make you have acne, it can cause unwanted, hairs on your chin, that kind of stuff. So, for men or women, it's not the preferable route for that reason. Now, there's going to be like a small percentage of people that do totally fine on it, though. And they, everybody aromatizes at a different rate. And so
Mhm.
I do sometimes have patients that come to me that are already on it and wish to continue. And so
Yeah.
that's what we do. But
My understanding too is that the injectable is better for muscle growth too. Is that true?
yeah, well, I'd say because you're getting you're getting more of it actually.
Mm-hmm.
You're honing in on your dose, so you know exactly what you're getting, and you're getting it to where you want it to in your bloodstream, right? When you put it on your skin, you don't even know what amount are you actually going to absorb. The absorption
Mm-hmm.
rate is going to vary drastically by individual. So for that reason, I would say also it would have an effect.
I missed that last one that came through. Sometimes those messages come through so fast. So I'm
Fast,
sorry.
yeah.
I got that. Hopefully, Carla, I don't know if you read that. Maybe you can answer that one on there. But anyways, well, I guess
Yeah.
we should probably, we've been on here for quite a long time. I really appreciate you joining me today. I'm so
Yeah,
glad that
thanks
we
for
got
having
on
me.
here this
I
time.
know, I figured it out.
Yeah, it's awesome. Now we've got it down pat.
Now I
We'll
got
be
it
really
down,
good.
yes.
We'll be really good for the next
Yeah.
time.
Yeah.
Let's see. So if anybody has additional questions, and you can always, I'm going to post this on my page. So you can go and put a comment on there, and one of us can go in there and answer that. But also remember that you can do a consultation with Amazing Meds, and you can do a complimentary one if you do it from the link in my bio and you use the code and you go through all of that. Then it'll be a complimentary one, and you might just get to talk to, is it Alyssa or Elisa? Elisa. You might
Yes.
just get to talk to Elisa personally. So, and she's awesome. So obviously very knowledgeable. So thank you for
Yeah.
joining me. Let's do
Yeah.
this again.
For sure.
Okay,
Have a
thanks
good
everybody
day. Thanks for
else
having
for
me.
joining in.
Alrighty.
Bye.
Bye.
Bye.